My Lords, it will perhaps not surprise your Lordship's House that as a Green peer I rise to offer my full support for all of these amendments, and I also declare my involvement with Peers for the Planet. Now, in introducing this so very comprehensively and I would say brilliantly, the noble lady Baroness Hayman said that this was equally important as the group that we were discussing previously, which was addressing inequalities and issues such as smoking and alcohol and their impacts on health. I'd actually go further than that and say that these two groups are intimately related in the sense that someone arrives at the NHS needing treatment for an illness or a disease at a point where the environment and society very often has failed, that has created or amplified that disease. And then the NHS has to deal with the problems created by society, by those environmental problems. What we are in here is a systems thinking approach to how we think about health, not just as here's a disease, here's a limb, here's an organ with a problem, but the whole person. And I do want to just very briefly express my regret that I wasn't able to take part in that earlier group due to not being able to be here at the start. Now, I'm not going to run through all of these amendments, which have been very well covered, but I think it's a great example when you look at this, going from the duty of the NHS to have regard to climate and the environment, right down to the detail of procurement, and I particularly commend the noble Lord Stevens. It's something we'd like to see much more broadly, the government taking control of procurement to improve our society by the means of which government is spent, and the Preston model comes to mind here. But I think, very briefly, I just want to address the climate side of this, and then I'm going to mostly talk about the environment side, which hasn't been much discussed yet in the other contributions. So I want to add something different rather than repeat. But I do have to highlight the fact that we are talking about 5% of the UK emissions, 40% of public service emissions, climate emissions. And we really have to think about, again, that interrelationship of environment and health. Heat waves, we know, have huge impacts, particularly on the health of older people, can be a very significant cause of death of older people. And it's something, the more the NHS contributes to climate change, there's a cycle there, obviously a very disastrous cycle. And also I'd point out the fact that I just found the figure that 10% of London hospitals are at risk of river flooding. And I haven't been able to find figures for around the country, but I'm sure that that would be true of many hospitals around the country. However, when I was starting to prepare for today, I was looking back to the Medicines and Medical Devices Bill, which we were debating last year. And it's a little unfortunate when I look around the chamber that there's practically no one who was in that debate who's here with us today. But what we saw with that was a huge missed opportunity, I believe, in that there's a requirement in that now Act that veterinary medicines, the appropriate authorities, when approving them, must have regard to their environmental impacts. Now, I moved an amendment and lost the vote to see that the same judgment was applied to human medicines. And that's something that, particularly when we come to the issue of antibiotic resistance, I'm not going to repeat everything I said in the committee speech in the Medicines and Medical Devices Bill on October 26, but it's all there, and the issue of antibiotic resistance and the management of that is a huge issue that the NHS, I believe, needs to do a great deal more of, as indeed do all global health systems. But what I wanted to focus on are some other aspects of the environmental impacts of the NHS today, particularly in the light of the Environmental Audit Committee and the Other Place report on the state of our rivers. And I note that the Bloomberg Green newsletter going around the world today has a headline, "England's rivers join Europe's most noxious with chemical cocktail." And that report notes, as many others have, that no river received a clean bill of health for chemical contamination. Now, what I would say to your Lordship's House is, of course, discussion of this very often focuses on the behaviour of water companies and untreated sewage. But even if we tackle that problem and get the sewage treated, some of the medical products that will have impact on that water quality are things that sewage treatment are not going to deal with. Plus, of course, there's impacts on air pollution and soil contamination, as I'll set out. And we have to look at this in the context of COVID. The UK healthcare sector alone has seen the demand for face masks up 4,700%, 85 to 90 million a month. Single-use aprons and gloves use have grown 550% and 200%. And the vast majority of these are plastics, coming from fossil fuels. And this has huge other impacts. If they are incinerated after their single use, there's more carbon emissions, there's toxic gases such as dioxins and furans, and toxic ashes. If they go into landfill, they will persist for hundreds of years, potentially leaching toxic chemicals into the soil. Now, I commend the NHS that there's a pilot project to introduce reusable IIR certified face masks, showing that it's possible to do things differently. But this is a pilot project, it's not something that's happening at scale. Now, I note that surgical masks were until the 1960s actually reusable. There were no issues of infection prevention and control, and they were at the time shown to be equal or even better quality than the single-use alternatives. However, large-scale production of these has now stopped, and therefore it's hard to compare them in the current situation. Many hospitals closed their on-site cleaning and sterilisation facilities, which have pushed them further towards single-use products. And this is not just an environmental issue. I note that in the United States, the UCLA Health has saved an average of $450,000 a year by switching to reusable gowns, just gowns. And basically, as a rule of thumb, reusable gowns and other materials have a 200 to 300% lower carbon footprint, as well as reduced energy, water and other resource consumption. Now, so there's all the plastics and the protective materials, but there's also what's in those as well as the plastic. And I come to PFSAs, which is a large family of organic synthetic chemicals which have linking them the carbon fluoride bond. Now, these are often known, you'll see the headlines, as forever chemicals, because essentially they never break down. They've been found in penguin eggs in the Antarctica and polar bears in the Arctic. And recently there was a study from Stockholm University in the Environment, Science and Technology Journal, which showed that it had been thought we could dump these in the oceans and that would get rid of them. But actually waves bring them back into the air, back into land. They're circulating everywhere. Now, what these do is they're impregnated typically into a liquid repellent finish in single-use surgical gowns and drapes. You'll also find them in ambulance jackets, for example. So these are real demonstrations of the facts of the really serious, and still we don't know the depths of the seriousness of these impacts, but there's definitely huge impacts here. And also, just while I'm on gowns, I do want to point out that there's been a huge trend towards treating surfaces with biocides. But of course, we come back then to the problem of antibiotic resistance that I was talking about earlier. And there's really not, experts say, and I note Healthcare Without Harm's work on this, that these have any actual positive impacts on reducing infection. So what does this mean in scale? Well, active pharmaceutical ingredients in wastewater, about 20% of them on average come from the healthcare facilities. That's a far from negligible amount, and of course also a lot of them are coming through household use of medicines. So, and I do just want to mention, again, Healthcare Without Harm has a really useful new report came out in November on this, and there's 5 case studies in that demonstrating how some European hospitals are dealing with these issues using urine bags to keep iodinated contact media out of the water cycle in Germany, researching thermal plasma in the Netherlands. There are things that can be done and much more that needs to be done. So I finish. I'm aware that I've been quite technical, but I think these are really important issues that we want to get on the record. And I've given the Minister prior notice of a question that I planned to ask, and that refers to, again, a Healthcare Without Harm Europe report, which produced a list of chemicals concern seeking to phase out of the entire healthcare system. And quite a number of regional health groups across Europe, hospitals, other medical groups across Europe have actually signed up to seek to ensure this list, and it has an 8-long, very detailed and serious list of chemicals. So I wish to ask the Minister, is the government ensuring that NHS England takes account of this and acts on this list, and indeed takes the kind of steps that we're seeing in Europe to eliminate these chemicals of concern from our healthcare system?